Welcome, everybody. My name is Michael Lombardo. I'm the moderator for this incredible session you're about to experience with Fresno County Office of Education, who are doing the integrated work within their county and supporting an integrated, braided, and blended funded model to make it happen for the children, youth, students of Fresno County. So we will start out with the first question for the panel. Why did you do this? Like, why did you embark on this incredibly difficult and complicated journey, as Jason has explained? But why did Fresno County work to integrate mental health in schools, and what was your vision for partnership?
Um, so I'll go ahead and get us started and give you a little bit of context. Our story started a very long time ago, way back in the days of AB 3632. Trina and I had worked together, and we were continually seeing the gap in services for our students out in our counties. In our county, our county is over 6,000 square miles. We have a lot of rural and remote districts where there just aren't resources. And so that had always been a passion of ours. So when AB 3632 went away, and the expectation was that county offices and departments of behavioral health would work together to create a new system, we started having conversations with our department. And we had conversations with them over the course of a couple of years, and we really weren't getting to a place where we could see eye to eye on what that would look like. And so we kind of left the conversation for a while. And fast forward to 2016, there was a Senate hearing in Sacramento as a follow up to the changes in AB 3632. How is it working now in the counties that this change has occurred? And I went to Sacramento and I testified, and I shared that we were not getting traction at that time with our local Department of Behavioral Health. And got back from that visit, and unbeknownst to us, there'd been a change in leadership. They had a new director, and she had watched this recording, or actually, I think it was live. And she said to her colleague, who did happen to know me for many, many, many years, and said, "Who's this Trish Small, and why is she saying these things about our department?" Susan says, "Oh, that's Trish. I know Trish. I don't know what's going on. Let's meet." So we met with Susan and Dewan, and we sat down and talked about what the testimony was, and it came, to both of our realization that we really wanted the same thing. And we walked away from that meeting saying we both envisioned that there needs to be more mental health services, and maybe there is a way that we can do this together as an educational agency and a Department of Behavioral Health. So from there, the conversation began. We formulated our vision over the next, it did take a couple of years. But what we ended up doing is they did make us a contract provider, and we really developed a partnership. Even though we were a contract provider, we did everything together. We envisioned the whole program. We designed a 5-year rollout, and the vision was to have a clinician or access to a clinician in every school in Fresno County over the course of 5 years. So, so we had our contract signed in 2018. We went live in 2019. And our first contract, we had the assistance of Elizabeth Estes to write it for us. She was instrumental, helped us out with HIPAA and FERPA. There were a lot of things to wade through, but we did it, and it was signed. And we started in January, and we hired a lot of staff, and that's where the road began. And so where we are now is we named our program All for Youth, and we actually through the All for Youth program created a whole continuum of care, because as Trina and Tammy are going to talk about, we started with All for Youth, which is specialty mental health. That is what our contract is to provide. But over the years, we have layered in other services at different tiers, and expanded to have a whole continuum. We really started there at tier 3. So we currently employ 200 All for Youth staff. We have 120 clinicians. We have 39 youth care specialists, 12 family partners. We have 6 wellness coaches, and we're going to be hiring more, a lot more. We also have clinical supervisors. We have quality support supervisors. We have a whole slew of staff that we didn't realize we were going to need until we started realizing with billing into the Medi-Cal system, we'd bill directly into their system that we were going to need all of these support staff. So we're in over 300 schools, and we provide tier 1 services in our wellness centers that Tammy is going to talk about, and Trina. And then we're opening 7 more by December of 2024. And we're expanding. We provide family partners and wellness coaches through some of our lower tiered services. And that's our why. It was all about access, providing access to all of these communities and families and youth that didn't have access up to that point.
Wow. I didn't realize it. The impetus was closed circuit television. Like, you didn't realize you were on TV.
They were not happy with us when we got back to Fresno.
You,
And a lot came out of that. Yeah.
you walk out of those hearing rooms and people will say, "Oh, I saw you." And you're, what? That's on televised?
Yeah, it's totally.
What a fortunate circumstance, though.
Oh, yeah.
Yeah, and the beauty of it was we had this shared vision, but it took time, but we got there. And I, in education for a very long period of time, I like to go fast, right? So I thought when we started having the conversation that there would be a big check coming, like we run the prices right. That didn't happen. So it does take time and hard work, but you'll get there.
How did you go about organizing the funding for this vision?
Okay,
So tell us a little more about that.
If we could go to the next slide. Yes. So these are our funding sources today. So where we started was a specialty mental health, providing services to the moderate to severe with a DSM-5 diagnosis. We have since braided that funding with SB HIP, the CYBHI. District assistants for us are those districts that have decided to invest money of their own money to cover students that have private insurance, because that was a big gap for us initially, was serving those students with private insurance. So they're actually contributing funds from their own funds to cover those services. Transforming Together is a partnership with community schools and behavioral health, and we're working with one pilot district to determine not only what are our internal needs and our own internal silos, but also expand on that to bring that out to the district and what resources do they have in place. And then HCI for the wellness coaches. We were awarded dollars for the wellness coaches, so we have started hiring wellness coaches and we'll be hiring more. And then we have a community school partnership where they're actually paying for some clinician time and some family partner time. So that's a partnership that we have. And then we received a small youth advocacy grant. And that was a gap that we identified early on, is youth advocacy. And Tammy's going to talk a little bit more about that. But it's just, that's really helped. And we have been giving out scholarships, and she'll tell you about those.
A real quick question for all of you. Background in finance, you graduated business school.
No.
So you
Yeah.
did this through grit, determination, and partnership.
As we think about what programs we're missing for students, they think about it in the same way, which is really wonderful, and kind of make the fiscal part come along with it and make it happen. I think you need that because they have a really, really good sense of what's needed, and they're part of our team. We make decisions together. They tell us, Trina, you can't do that. And I say, well, let's find a way. And they're really good about that. But they find a way usually. We're very fortunate to work for a county superintendent who is willing to take a little bit of risk and really wants to provide those services to students because there's risk involved in this. I mean, this is something that hasn't been done everywhere, and so you have to go out on a limb sometimes to be able to do that. And so she's very supportive and she's very innovative. So that's really, really helpful.
And Trina's trying to be really humble here, but her and Tammy are like the total money brains over here.
Right.
Yeah, I was going to say we're all school psychologists, but I think I became very knowledgeable in finance and facilities. I'm a facility person a lot of the time. So Yeah. And so we've learned over the years lots of other tricks along the way to put in our toolbox. And basically, yeah. So you are everything. Yeah. Because we want this to work and we want to be very innovative and have a shared mission and vision. And so, yeah.
So a real growth. So the nuggets you can start to take away from today is growth mindset,
Yes.
and be very, very sure you take your business office along with you.
Yes.
I show up at a lot of meetings and business people aren't there. And we're trying to move these gigantic fiscal levers and they're just not in the room. And I think at least my previous business department really liked to be there at the beginning of the conversation, not at the end of the conversation.
Yeah.
So the next question, with all these types of integrated funding, how do you coordinate it?
With the fee schedule that we're going to talk about, that will finally give us that continuum of care. So these are our 3 levels, and these are our funding sources there at the bottom. Next slide.
Can I pause for 1 second?
Yes.
So nugget number 2 or number 3, organize your fiscal structure within your tiered framework. Like we always think about that as program, but think about your funding structure also in tiers. Because if we don't, we tend to focus on what tier 3. And what do we then tend to do? Put kids in tier 3 to get services when we're not doing prevention first.
Yeah.
So when we started, as I said earlier, with the specialty mental health. And that was a 5-year agreement with the Department of Behavioral Health. We were using a cost reimbursement method, meaning that if we adhered to the agreement, we were reimbursed for our costs. So we went through the first 5 years with that. And but then came CalAIM reform. And so in July of 23, we had to move that was our next contract, and we got a contract in our partnership for a 1+1. So one year, if we did well, they would extend it another year. And we're in that second year now. Wow, moving to a fee-for-service schedule was a really, really tough thing for us. The first 3 months we were in the red because it becomes all about productivity. You have to meet that productivity to be able to pay for the program and to provide those services to students. And I started to get really panicked. My team was like, "Are you going to fall apart on all of this whole thing?"
It's not for the faint of heart.
And so our first 3 months we were in the red. July was the worst because kids weren't at school and we were just starting to use this method. And then the 4th month we got in the black.
And during that time, we had a new electronic health record.
Oh, yes. We also shifted. So we actually bill in to the Department of Behavioral Health's electronic health record called Smart Care. So all of our clinicians and case managers and staff bill into that system. And so we started moving along. So this last school year, we, as many of you know, the rates in California for these services vary by county. Our county happens to be a county that is a low rate in comparison to our neighboring counties. And then each county gives a percentage of that, whatever you generate, to you to operate program. So like for us, we billed $36 million in the first year with the reform, and we get 60% of that. So when you think about how lean you have to become to do that, so 10% is going to be admin cost, indirect, staff that are out on leave. So really, we're operating at about 50% of what we generate when it's all said and done. Mileage for us, because we're a large county, is very expensive. Like last year, it was over $800,000 for mileage to travel all throughout the county. Very, very expensive. So we run very, very lean. And this year, we're doing pretty good. Starting this year, we're about in the same place we were last year. So that's a good thing. But just know that this is something where, I mean, you have to stay on top of that productivity. And you have to build those units. And then we have 3-day note turnaround time. So they have to get everything inputted within 3 days into the system. And it's hard on staff. And I think that especially when we started doing this last year, it was particularly hard. But as time went on, they got used to it and they knew where they needed to be and they knew how many units they needed each day and and they found creative ways to see kids. Okay, that student didn't show up, but I can be doing this over here. I can make a phone call, or I can go to the classroom and I can do these things. And it was really important that we make sure our class integrate into the school system. So we said, and we still reiterate it all the time, you need to go in, make yourself a part of that culture. Go to the staff meetings, go in, go see the students, go on the playground, do all of those things, so that they integrate and they're seen as any other staff on the campus. Because otherwise, I just don't think they would be able to meet that productivity had they not done that. And we revisit that all the time, especially with new staff. So that's the first funding source there. It's about a $25 million program. Even though we bill more, what we're getting is about a $25 million program. And when we first started, we also got prevention and early intervention dollars, the PEI dollars, which has since this year, they've taken off the P, so we don't get prevention, but we're getting early intervention dollars. So that's been a change over time as well. Private insurance, still a big challenge, of course. And then we started, okay, so now we've got this going. Now how do we start to bring in other dollars and braid the funding to help us, maintain this program? And so we applied for the Mental Health Services Oversight and Accountability Commission. That we asked for 12 family partners with lived experience. That was a very difficult thing to get into our job descriptions. Our HR it really pushed back on that because they felt like, these people are going to disclose all of these things to us, and then, what if they don't get the job? But we said that this is the way of the future. We really need people that have that lived experience, that our students and our families can relate to them. And so we finally got it in our job description. And as we're going along, we're creating job descriptions that, we didn't have in place as a county office. So we're doing that as we're going. And then with the specialty mental health side, we also have, we contract for a psychiatrist. We've had an opening for a long time, and we finally have 2 applicants that we're going to be interviewing, but it's stayed open for well over a year. So we contract, which is very expensive. It's all telehealth, and he stays really, really busy. His rate that he can bill, though, is very, very high. So he pretty much pays for himself, even though it's a lot of money. And then we brought in the SB HIP. Oh, we also opened 5 wellness centers with that as well. So we looked at counties that were very rural, where we didn't have space. As you all know, space is such a commodity. There's never enough of it. And so we have to really be careful about what days we place clinicians at sites, because they may share with the school psychologist or with the nurse, or they share space. And so in the wellness centers, Tammy's going to tell you all about those, how we built them, but we created space for the clinicians as well in those wellness centers. And districts that are surrounding them also have access to the wellness centers. So that was our ask for the Mental Health Services Oversight and Accountability Commission. And then comes SB HIP. And we asked for 8 bilingual family partners. We wanted them to be in our wellness centers so that they would be available and connect families and students to resources, provide trainings. Tammy's going to talk all about that. We asked for 4 rural mobile health vans, because transportation for a lot of our families is really, really hard, and we have some very rural areas, very far away, mountainous areas, and so we actually go to them. So if our clinicians check it out for a day, it has a therapy room. Tammy's going to show those to you, and then we asked for 7 additional wellness centers located regionally throughout the county. So those were our asks at SB HIP. The 2 managed care plans, Anthem Blue Cross and Calviva in our county, have just been absolutely wonderful to work with. Been wonderful partners, just like Fresno County Department of Behavioral Health. Louise is here today. She oversees our agreement with them for the specialty mental health. And so it's really nice that we have that partnership together. Then the Youth Voice. We've been doing Tammy's going to tell you about the scholarships we've been giving out. And then district contract assistance, that's where the districts are contributing their dollars to cover those kids that have private insurance. And then we applied for the round 2 of the CYBHI. And what we wanted to do with that is ensure that all of our clinicians and case managers go through trauma-informed cognitive behavioral therapy. So they're being trained now to all get that. Then we applied for the wellness coach dollars, and we got that. We can hire 54 wellness coaches with that. Again, using the space also in the wellness centers. That's where we're starting with those staff. then transforming together, that partnership between community schools and behavioral health, our department. And then the Mental Health Services Oversight and Accountability Commission came out with other categories of funding. We applied for 3, we got 2, to add 1 more mobile van and 1 cargo van, and hire a quality improvement and sustainability coordinator. So that's where we're at today. And then we're getting ready, and we're going to tell you about the fee schedule.
So while you're talking, that phrase, think outside of the box, popped in my head. And then the next phrase that popped in my head was disregard the box and just do it. Just move forward. That's remarkable.
Yeah.
Okay.
Okay. And then I'm talking about tier 1? Oh,
This is tier 3. So this is our tier 3. These are what we offer under tier 3. I've told you pretty much, I've covered everything. Told you about the psychiatrist. They do also identify students that may need a higher level of care, so that we will refer out for a higher level of care if we need it. Okay, tier 1, Tammy.
Okay.
Quick question before
Yes.
we go on. Can you tell us a little bit about how 2083 integrates into this work, or what are your thoughts there?
AB 2083.
AB 2083, sorry.
Yeah, where we are right now, we are rewriting our MOU and making sure that we have all of the entities included with us. That's the first thing we needed to identify. We just added a judge, and we just added someone to represent the tribes. And now we know there's a few others. We added community schools. Community schools was not a part of the AB 2083. And Richard Connect is actually working with us to help us through that process, which has been a really great process. And so that's kind of where we're at. And also, each of us do a presentation at each meeting to determine what we do. We didn't know what each other did. So, because we don't want to duplicate those services, and it really frustrates families when you say, fill this out. Okay, now fill this out. Now can you fill this out? And so we're really looking at where is the overlap, and try to reduce that frustration for them. So we're just kind of in the beginning stages, and it's really, really exciting work. So, but that is the group that we feel like where we have everyone at the table, and rather than have another meeting that you have to go to for leadership, really, if we could get everybody at the table for AB 2083, that could be our county leadership group. So that's our goal.
And the reason I asked that is because when you think about all of these levers, and I didn't keep count, maybe 15 different funding streams, they require partnership. It requires this integrated system, integrated belief system and vision on how we're going to support kids in Fresno County in a whole child approach to meet kids where they're at and move vans. Like, there's no universe where you could have done this without the collaboration.
Right, exactly.
So, okay.
Tammy?
Okay, and so I'm going to go for tier 1. When Trish and Trina were sharing, we started again with special mental health and early intervention. So we started with tier 3, and we've been open for business since 2019 doing tier 3. And so now with MHSSA and SB HIP dollars, we were to add our tier 1, which was our wellness centers. And currently we have 5 open, and those are our MHSSA ones. And we're now opening up actually this week and early December, we're having opening 7, which I'll show you a couple pictures in a minute, of the remaining 7 wellness centers. And again, they're strategically placed in high need areas, and they're on school campuses. And we really had to have a shared vision with our LEAs and walk through what those wellness centers would be and where they would be located on campuses, because safety was number 1 for them. So they didn't want to put it in the middle of the campus and have parents come access. So we really work through that and what that would look like with each of our school districts. With a total of 12 wellness centers, we'll have them all open up in early December. So we're really excited about that. But of the 5, we have been doing, we have Wellness Wednesdays. We do lots of different activities. We do yoga. We do workshops. Our bilingual family partners and now our wellness coaches are in those centers. and they're doing screenings for mental health, screenings on development, screenings for SUD. They do a lot of linkage and referrals. They're also in the community looking at other resources. And our biggest need at our wellness centers have been navigating mental health, of course, so our family partners help that. But also, our family partners really have been looking at what the need is in each unique community. And a lot of it has been around all social determinants of health because of they need hygiene products, they need clothing, they need backpacks to get ready for school. So oftentimes we're gathering all that and helping families how to get those for back to school, So a lot of linkage of referrals. We help re-enroll families back into Medi-Cal, or if they've never had Medi-Cal, we do that. And really, the wellness centers are a safe space for our youth to enter. They could come, relax, get regulated. They could do activities and games because somebody is right there supporting them. And they have take a break card and they go back to class. So we're really excited about those. And then also our rural mental health vans, I call them treatment on wheels. So we could go out to the community and oftentimes we'll do home visits, but some of our families are a little hesitant to let us in the door. I probably have been doing home visits since 2000. So I have had so many IEPs and IFSPs on the hood of a car. But with these vans now it's a treatment room with AC running where we could go into the room. It's tinted and we could have a confidential conversation with a parent if they don't want us in their home. Also, we take it to some of the school sites that don't have space. Space is the number one barrier we have in our schools. That's why we opened up the wellness centers and have our rural mental health vans available.
I love it. And if y'all haven't been to Fresno about 4-5 months out of the year, it's hot.
Oh, it's very hot.
So I'm getting this vision of you on the hood of a car.
Oh, it's very true. Or in the fog. Mm-hmm.
Don't touch the metal.
Yes, exactly. So here's some pictures. And if we have a learning session after here, we're going to go deeper and we have some pictures on each one of these. So you'll see this is one of our brand new wellness centers that are going in at one of our school sites. And what I like about this is you could actually see the wellness centers are a 3-by brand new modular building. So it's over 1,400 square feet. And you'll see over on the left, you'll see those doors. So there's 3 confidential private treatment rooms in the wellness centers, a restroom, and then a large enough space to convene and do yoga. We do workshops. We have staff meetings. There's lots of different things we do there. But what's nice about it is 2 of those rooms you could enter and exit. So it's a multifunctional space. So you could have yoga going on, and say you have a parent coming in. You don't have to walk through yoga to get to the class, to your treatment room. No, you enter and exit from the exterior door, and there's an interior door as well. So it's a multifunctional space. So
Every single school in California needs that.
Yes, it's a work of beauty. We love it. And then that's just how it's getting set in. And then I think there's one more slide of one. Okay. But we have more photos that if you come to our learning session, you could see our van and more wellness center pictures.
Ready? Tier 2. Yeah. Okay. So for Tier 2, we're very, very excited about the fee schedule because this is what will complete our continuum of care. We'll be able to provide mild mental health services to students for our districts that join the consortium. Most of our districts are joining our consortium. Fresno Unified and Clovis are doing it on their own just because they're so large. We felt like we didn't have the capacity to provide those services at this time. So we're doing it for the other 29 districts and then charter schools. And so these clinicians, our clinicians for specialty mental health are 215 days. These clinicians will be 185. So they'll have the same daily rate, but they'll be 185 days. And that's because for specialty mental health, we provide services in the summer because the mental health needs don't go away. They're severe. For this, we can stop providing services in the summer for the mild. And so we have to stagger staff for the specialty mental health so that we make sure we cover the summer. So for our consortium, they had 3 options. The options were they could do it all on their own and take the capacity grant funds, or they could get mild services from us and not bill for their eligible practitioners, so like their school psychs, their nurses, and everybody, or that we would help them with the billing for their eligible practitioners and provide the mild mental health services. So most of them chose the option of billing for their providers and receiving mild mental health services from us. So we're getting ready to start. We've hired some of the staff already, and we're starting with where in the districts where those wellness centers are located. So in those 12 districts is where we're starting because of space. Anything you want to add to tier 2?
No, as well as the other thing to add would be our wellness coaches, starting at the tier 2 because they could do screenings, they could run groups, but they'll be working closely with our fee schedule. Yeah, so with our tier 2 fee schedule clinicians with our wellness coaches. So
Yeah.
Excellent.
Excellent.
Okay, so you've talked a little bit about how you've staffed the continuum, but is there anything you'd like to add to that?
Yeah, just next slide. One of the things that was really important to us is creating a very, very robust family tree for positions, because we knew we were going to saturate the market right away and we wouldn't have enough. So we wanted to create something where the staff that we hired could promote into other positions. And so these are the positions that we have. And I mean, you can start as a family partner and move all the way up to a director, and through those steps. And so when we interview, that's something that's very people like a lot, because they'll ask, is there any room for growth? And so we have that family tree where, yes, we tell them yes. What I've noticed in our interviews with clinicians is that many of them will say, I wish these services were available when I was in school. And I want to work in a community where I give back to a small community. That's where I grew up in. Many of them say that. So they're really dedicated to working with students and working in those schools where perhaps, they went to school, or a neighboring one. We try not to put them in the district where they went to school because they may know a lot of people. So we do try not to do that. But this was a really important piece for us.
So two things you said several times: family, right? So you created a group, a family, which I believe helps with decrease in attrition and people leaving. And you've created it literally in the picture. There's your workforce pipeline.
yeah.
And so people can come to Fresno County, belong to a group, and also know that they could promote through that.
Yeah.
And I think here's a picture of the family.
Is
Oh,
do you have
back.
this one? This one.
I missed one, sorry.
Okay, no, it's okay. The other thing, in my whole career, I've never experienced this, but when you start a program from the ground up, you can really. It was important for us to hire staff that our students could relate to and our families could relate to, and I've never been able to do that in my whole career. But when you start from the bottom ground up, you're able to do that. So we look at. Yvette over there is our clinical director, and Tammy, and we look at, okay, we need a clinician for this school site or this district. This is the demographics of that district. We know what we need. And so as you see, I mean, we've been able to do that, which is pretty amazing. And many are bilingual, so they speak those languages as well. But that was really, really important to us, because there's so much research that, students want to talk to somebody that they can relate to. And so we've been able to do that, which is wonderful.
And there's the family.
Yes,
There's our
yes.
family.
Yeah, and I was going to say, really, it's important because we have hired over 200 staff, and we wanted to celebrate the wins. We have over 112 clinicians. So
120.
120, yeah. So we've hired a lot of people. So we want to celebrate the wins. We want to have that connection because we're a large county, and we are, integrated into schools where we could come together. We have, what's amazing is at Fresno County Superintendent Schools, we have, I don't know what you call it, we call it's Scout Island, but basically our safe and healthy kids has where we could go out, and it's on the San Joaquin River, and you could canoe, kayak, and it's all these great interactive learning experiences. And it has a zip line, and that's where we were this day. It has a ropes course, so we all go out. We have lunch together. It's all provided. And we do the ropes course together. We do all these great team building activities to learn, like, how do we balance this? How do we get it on? And how do we work together to make this a success? And so by doing all those activities, we've really integrated and bonded, and we always want to celebrate the successes. So, like, I just have a couple things down here that we've been in business, like, this is our 7th year. Eighth year? Oh my goodness, it feels like only 2. But anyways, but we, over the past several years, we've had 15,500 referrals for our agency. We've served over 10,000 youth. We get over, I would say, 50 referrals to 100 referrals a week. So it's a high volume and high need area. And so we met this challenge. We continue to grow and advance, and always think about how we could serve our youth and families as well as our staff, such as the CYBHI round 2, where we could get trauma-focused CBT. So it's always balancing what's really important for our school districts, what's important for our youth, what's important for our staff, and really have a shared vision across the board for serving youth, and we're all stay healthy and well, you know.
I think the other thing that we did is we created one name. So we put everything, all services that are behavioral health related under that one name. You know, you can get programs and this one's called this and this one's called, and then people don't know where to refer, where to go or where to refer. So we put everything under the All for Youth name. And so I think it helps families know that this is the one place to go to get help. And then, did you want to share about the trauma trainings real quick and
Oh, yeah.
threat assessment?
Yes. So one of the things that we did when we started bringing clinicians into the schools is we had a very structured onboarding process where we went in and we met with the leadership team and the mental health folks and talked about what the clinician services were going to look like and what this integration would look like, what they were going to be getting from us and what we expected back from them, office space. And we also required them to go through trauma trainings to have all of their staff on their campus ideally. And so they all participated in a series of 3 trainings, and to help them to bring about that understanding and knowledge about the impact that trauma has on development, on the brain, on the way students, behave and how they can regulate their behavior on the campus, and then what they in turn as adults can do to create a more supportive environment for their students and how they can have impact how their students are coping at school, and also weaving that into, when is it a good idea to make a referral for a behavioral health evaluation. So those trauma trainings, we've trained over 12,000 staff, and as reluctant as the schools were to have to do one more PD, they all loved them. Mm-hmm. So that was a big win for us. We were really happy about that. And then recently we've just been expanding our coordination. We do a lot of crisis response at our office, and so between our school psychologist team and our All for Youth team, our districts, anytime there's a crisis, can call us 7 days a week, 24 hours. To be ready to deploy our teams together to whatever school district it is to respond, whether it's a student or a staff or some other crisis that's occurred on a campus. And then also in our county, we have developed a level 2 targeted violence prevention task force. There's been increasing numbers of students who have been making threats against other students. And so we have put together a task force, and we've been partnering with our mental health folks to help identify those kids early and be able to get them off that path of potential violence. And so it's just the enhancement of the mental health folks in all of the things that we're doing in our county it's just tremendous.